Hello. So we decided to do our presentation on the United States healthcare system and how to overcome the challenges of providing mental health care services to people here in America. This is group 3. This is presented by me, Juliet, Yusuf, Catherine, and Rachel. The prompt that we picked was from module 4, question number 3, and it had 4 different parts to it. The first part was just a little background on how mental illness care has evolved over the last 3 centuries. Then we describe what mental health parity is and move into the primary challenges that are presented with providing adequate mental health care services to people in the United States. Finally, we end with proposing some solutions that may be able to solve these challenges.
All right. So the evolution of mental health care. So it dates all the way back to ancient Egyptians and it goes all the way throughout the Middle Ages, where the beliefs became very spiritual of why people were becoming mentally ill. This was due to a demonic presence or a supernatural cause. Now, especially during the ancient Egyptians' time, they had a very brutal form of treatment. Now, back then they didn't have any anesthetics, so let's keep that in mind. They didn't have any tools that were sterile enough to do these procedures, so they would do triphoning, which is literally hammering a hole into someone's skull to let these negative energies leave. Now, if you think about this, this obviously was a very brutal form of treatment. So this caused lots of deaths, lots of injuries, further damage, and obviously people would die but from infections since there was no antibiotics and stuff. So definitely lots of infections, very brutal form of treatment. Obviously probably didn't work, probably would end up killing someone before working. Then it moved on to a more spiritual treatment. Now, this doesn't mean there wasn't other brutal treatments during this time, but it moved more into being exorcisms, incantations, and prayers because they believed it was mental illness was caused by a demonic presence. So then by the mid 18th century, insane asylums started to pop up. Then in the mid 18th century, the state of Pennsylvania opened a hospital in Philadelphia where mentally ill were housed in the basement. So there was such negativity surrounding this type of illness that they didn't want people to know about it because they didn't view it as a medical condition. They viewed it as someone that was crazy and that there was other reasons why this person was acting this way. This also dates back to being like negative, like demonic presence, supernatural, all this type of thing. They literally thought people were crazy. Now, the family's responsibility was to take care of their own mentally ill relatives. If they were not taken care of by their family, they were placed into these insane asylums in the basements, jails, or almshouses. So mentally ill were not treated sensitively until the 19th century. So throughout this period, asylums were developed across the country where they were overcrowding because people started to go get help. Now, this definitely caused an overcrowding because there wasn't that many hospitals that would take this type of patient. So these facilities were heavily relied on government funding, which resulted in inhumane condition treatment of patients. Now, this leads back to patients being treated in a basement. There is nothing humane and sanitary about being treated in a basement when you're supposed to be in a hospital. Because it's not the basements we see nowadays where they have nice rooms and stuff. I assure you there are basements that were literal dirt, like just plain disgusting. And that just showed what negative stigma was carried within having these illnesses. So then by World War I, the states mandated the funding of care and treatment for the mentally ill, and they decided to rename these asylums as mental hospitals rather than the insane asylums, which is very derogatory towards the mentally ill. Throughout the war, many veterans came back to their homes with PTSD in need of mental health care. They had just returned from a very traumatic place. They're obviously going to return with mental illness and need some help. However, this also led to the beginning of using medications for mental health treatment, which was another step towards progress. The use of unethical treatments such as electroshock therapy and lobotomies were still being used on patients. Now, this isn't as bad as trifling, obviously, but it is similar. A lobotomy is literal brain surgery. There should be no need to do brain surgery as a treatment. However, they believe that this was a way to get somebody to comply with them and stop acting the way they were acting. Just like electroshock therapy. You can't shock the mental illness out of someone. That just doesn't work like that. So, by World War II, the government had shifted their focus on mental health and created the National Institute of Mental Health. Funding was being used for mental health training, research, and the VA opened up hospitals and clinics for the mentally ill. Again, veterans were coming back from another traumatic war, and they were coming back with PTSD. So the VA decided to start opening these hospitals where veterans could go get help after seeing such trauma. This allowed distressed veterans to get the necessary mental help when returning home from the war and chaos. Furthermore, in 1952, the first psychoactive medication was developed that allowed outpatient treatment of mentally disabled patients, which also led to the creation of the U.S. Commission of Mental Health that evaluates hospitals and quality of care. By the mid-50s, people are starting to realize that you should probably start focusing on the quality of care that these patients are getting. It was starting to become a serious topic, not something that could just be thrown under the rug. So this also led to the first creation of a DSM by the American Psychiatric Association. By the 1970s, mental health centers were developed and established by the federal government. So they were starting to become more known. So this led to the 1990s study of reasons why patients were not seeking help, which brought about the discovery of large numbers of people being ashamed and embarrassed to seek and receive their help they needed. There was still that very negative stigma surrounding mentally ill patients, people that just need help because they're suffering of a mental illness. Nowadays, it's super common. Back then, it was still seen very negatively. It still had that negative stigma surrounded by it because people thought you were crazy. They didn't think that you just needed some help. They thought you were just mentally insane. So there's still that negative stigma. However, we're starting to move into an era where there are treatments and there is help, so people will start moving along slowly. Then by 2002, the new Freedom Commission on Mental Health was established. And then finally, by 2008, the Mental Health Parity and Addiction Equity Act was created, which supported mental health care by requiring insurance plans to offer mental health benefits. This allowed for more affordable care and wider access to the care needed for patients. Now, people probably thought that it was too expensive to go get help. So now that it was incorporated into insurance plans, it became a lot more accessible for people to be able to actually go and get the help that they needed.
Mental health parity. What is mental health parity? Using restraints and procedures for managing conditions for therapeutic and surgical welfare and insurance coverage, such as substance consumption, illness, psychological fitness. But it doesn't provide assurance for good care. It guarantees equity and cover. Limited health cover is minimal plan. Mental health is even smaller. In 2008, Congress had a meeting to amend the mental health parity, but to be implemented in 2013, certifying equal treatment for mental health conditions and addictions. Health plans are obliged to go into par with this. Procedural criteria for exception and rejection in psychological health services needs to be essential, realistic, and suitable, such as supplies and medicine. Because psychological fitness is a great essence as the other health problems. That means we should include mental health into this.
All right. So after we have examined the history of mental health care in the United States, and we now understand what mental health parity is, we know that the United States has made an attempt to overcome a lot of the primary challenges to providing adequate mental health care to people in need. However, there are a lot of barriers that still exist that prevent people from receiving necessary treatment and services for a lot of serious psychological health conditions. So we're going to go over those different challenges, but first I think that it's necessary to understand the prevalence of mental health disorders here in the United States. Recently, research revealed that 1 in 5 United States adults have actually experienced some sort of mental illness. And this was in 2019, which is prior to the pandemic. Since then, the numbers have actually grown significantly. More people started reporting different symptoms of anxiety disorder, depressive disorder, and we're just trying to cope with different emotions and stress that were related to COVID-19. And even though the pervasiveness of mental illness is really widely known to the public, we found that less than 50% of mental ill patients were actually able to receive the treatment that they needed for their condition. This only further emphasizes the challenges of providing adequate mental health care here in America. So we're going to go to the next slide. So these are the challenges of providing mental health care in the United States. The first one is limited coverage. We talked about the Mental Health Parity Act and how insurance companies are required to provide fair coverage for the people that they cover. So even though the mental health conditions and traditional health conditions are supposed to be equal, it doesn't mean that there's going to be good coverage. So in this way, a lot of different conditions like diabetes and mental health illnesses such as anxiety disorder, schizophrenia, those different things are actually limited. The second one is financial barriers, which is extremely prevalent here in the United States. Lots of different treatments, including medication or therapy, is unaffordable to a lot of people. But not only that, they also have really high indirect costs that patients might experience just as a result of having a mental health disorder. So we know that some people were going to need housing support, job training, rehabilitation, and just other forms of assistance, but those things aren't funded by health insurance. So the third one is outdated practices, which basically means that even though you can find good coverage for your mental health treatment, it may not be very easy to find quality care that is up to date. A lot of seasoned mental health care providers and clinicians are trained using older models, while maybe the current healthcare workers might be using newer treatments. So the patient's quality of life can really be affected by the type of treatment they receive and the effectiveness of the medical care. This includes different things like medication, therapy, operations, remedies, just things like that that are important. So it's important to be educating these new providers and re-educating older providers on new techniques that they can be using to help treat mental illness in today's society. The fourth one would be provider shortages. And a lot of people know about this, but there is a shortage of providers and a lack of capacity for patients in these mental health care facilities and in hospitals in general. A lot of people who seek treatment aren't able to receive the service that they are seeking because there aren't any psychiatrists to meet their demands. This shortage is actually going to inevitably cause and has caused a mental health crisis. Different impacts of the healthcare provider shortage include things like the opioid epidemic. And this is due to the lack of access to treatment for drug abuse. Ultimately, the provider shortages are going to lead to longer wait times and mental illnesses just being left untreated. Finally, number 5 is the lingering stigma that surrounds mental health. It has lingered throughout history and it's still very prevalent in today's society. A lot of people are afraid or avoid treatment due to the prejudice and discrimination against people with mental illnesses. They're afraid of different things that might happen if they seek help, if they seek treatment. And so these issues can be attributed to a lot of the cultural and societal ideologies that have passed down from generation to generation, and as well as the underrepresentation of people with mental disorders to the general public and in the media. So we see how prevalent the mental health conditions are here in the United States, and I think that it's only going to get worse. So we're going to talk next about the solutions that we can try to implement into the United States healthcare system in order to just try to provide more adequate healthcare to the people that need it.
We are proposing a solution for the mental health care system in the United States. The last part was the challenges part that was done by Juliet, and she covered a lot of challenges that the United States is going through right now and trying to overcome. In my opinion, the main 3 challenges in that part were insurance coverage, staff shortages, and financial barriers. The only reason that I picked those challenges because they all have a domino effect on each other, where if one of them is done incorrectly, the other one will be negatively impacted. So, to start with, the insurance coverage in the United States is built onto 2 factors. It's a hybrid system where the first factor being a single payer national health factor, and the second factor is the multi payer national health insurance factor. The single payer factor is when one entity is control of that insurance, such as government, unlike multi payer system where it's controlled by multiple entities, such as private companies and the government. Sometimes those are funded by private money and taxes at the same time. So, while diving deep into the insurance coverage issues and challenges, we discovered that more than 57% of Americans face at least $1,000 or more of medical debt. And this shows why debt forgiveness as a solution is one of the best solutions due to not only would help the lower class, however, it would help the middle class as well to be able to afford to live in the United States with the prices increasing everywhere. And the other solution would be universal healthcare. So pretty much the healthcare is that would be set up as how Canada has it right now, where every citizen, a Canadian citizen, has access to insurance. So if it was in the United States, every United States citizen or permanent citizen would be covered under one insurance that is controlled by the government or in some cases private companies. Universal healthcare would not only benefit lower class, however, only benefit middle and higher class by taking away a lot of the insurance debt. And this goes over how it is important due to the recent situation when and stories that came out with the pandemic, how where more people were more concerned about medical debt than their own health, were on their verge of dying. Their question was, how much is this going to be? Moreover, the next issue and challenge would be the staff shortages for mental disorders. So when it comes to the first option, it would be budget increase. So pretty much, to explain budget increase, we would have more training resources, more PCPs to be able to take care of patients instead of having the patient to go to a hospital or be prescribed a specialty order. This would help for more resources such as equipment and clinics, and it would make it easier for the nurses or PCPs to go ahead and take care of the patient right there instead of having the patient to wait with the long appointment lines in order to be able to see a doctor. And this shows an estimated of 122 million Americans, or 37% of the population, lived in an area where healthcare professionals were scarce for mental health care. The nation needs about almost 6,400 mental health care professionals in order to be able to fill those gaps. And this shows pretty much the lack of budget is evidently clear. The budget almost faced a cut of almost 42.8 million in 2018 from 375.5 million of 2017. And this shows how pretty much with the budget increase will have a big impact on the patient and the providers as well. The other option would be mental health care communities. So those mental health care communities, it would be community training for family support and for other people to be able to support their own community when it comes to mental health care, such as mental health care awareness or promoting self-care. When it comes to those mental health care communities, it will be less option and less budget. It would require less of a budget than PCPs and nurses. And this shows how in the beginning of the PowerPoint, I tried to explain how they all have a domino effect. And this shows in this case, budget increase will affect the more nurses and more PCPs and more training that we can have to drive the mental disorder cases down. However, they all link together. So in order for us to have a perfect system where mental disorder cases are really low, we need to have a good insurance coverage such as universal health care and budget increases in order to be able to cover those universal health care and to cover more training and be able to cover more mental health care communities. And this shows how they all are related to each other and they're all dependent on each other. And if one of them is done incorrectly or one of them faces a bigger challenge, it will negatively affect the other one.